Awesome, awesome. Well, the floor is all yours.
Okay, well, thank you very much, everybody. I appreciate you taking your time to listen to me for the next, 40 to 45 minutes here. Um, Val will let you know I'm a very active person. So at the end of this, of course, I would love for you to join in for about 7 to 10 minutes, maybe, of some light exercises, which you will have a copy of that program as well for you because it's important as I discuss everything that myeloma patients stay very active, and that's one of the issues that they are facing in this current climate right now. So I will start my presentation. You guys be patient with me and my technical background here. I'm used to writing papers, not doing presentations, okay? uh, Technology is always something for me. So what we want to, of course, as I'm trying to get it to go, it won't do what it's supposed to. What we want to understand, um, and this is in any community, whether it's the Black community, any minority community, even the majority, there are certain factors that tend to identify what might be causing some of the stressors in any disease. And for the Black community, for multiple myeloma, um, they tend to be a little bit more um, in the forefront of what being exposed to this disease, and because of that, they are facing huge disparities, whether it's accessing resources, whether it's accessing some type of uh, nutritional assistance, and of course, trying to get some type of physical activity in their world. My slideshow is very laid back, so to speak. It's not going to show you a lot of presentations, statistics, but I will talk to some of the findings that I have. This slide that you see up front right now is from a young man, and it's a group called Guru. And he says that as a community, we have to hold arms if you're going to get through something. Proactively check on your friends. And this is not only in the Black community, but I think older folks as well. They tend to keep to themselves, and they're not proactive in what they need to do to stay healthy. So we get to something like a third or fourth stage of a cancer, and then we're trying to figure out what the options might be. Unfortunately, most of the time, that is not. It comes to be, um, almost terminal when we get to that point. But to identify who we're looking at right now, most of the folks that are in this group are over 50 years or older. Typically, on the Caucasian side, they don't see myeloma uh, cancer cells until the average is 69. So for some reason in the Black community, it's 50 years, and some are even younger. They tend to be Black men, and of course, they're of African descent. There are other precursor conditions, the biggest one being obesity, any other uh, big diseases such as diabetes and other cancers. So we need to understand what is out there, those risks, and how we can minimize those risk factors. Um, if you don't already know, which you should know, multiple myeloma, of course, is the cancer of plasma cells in our bone marrow. We are 2 times as likely to be diagnosed um, with um, with multiple myeloma at the earliest onset, and then there needs to be, of course, something to address to these disparities. Um, Continuing routine checkups, eat healthier and add little daily exercises, even if it's just walking. Everybody thinks that they need to do something drastic when it comes to starting exercise. If you do a little bit each day, yeah, it's going to take you 6 to 8 weeks probably to see something, and probably even more if you're almost you don't move at all. But with that consistency, you will see some progress in time. You might not be able to do a push-up, but in 3 or 4 months, you might be able to come up with 3 or 4 push-ups, which is huge for anybody in any type of physical capacity. So we need to understand and try to do better and spread the healthy advice to people around us. I'm going to share this quick YouTube video from Empower, which is one of the organizations that works in the community to help people with multiple myeloma. Bear with me 1 second as I pull this up. Can you guys see that screen?
Yes.
Okay, good.
We
Don't
can
have, yeah, we
hear
can't, Vania.
you need to stop sharing entirely and reshare again and mark this share sound box.
Okay, because you couldn't hear it, right?
Yeah.
Okay, so let me go back. Thank you for your help. All right, let me try this again.
I still don't hear
Still
anything.
can't hear it?
Yeah, but when you click share your screen, when you click
Mhm.
share screen, uh, did you mark the share sound box?
Oh, I did.
There's an option there. Maybe it's at your down right side of the window. I'm not sure, but when you click share screen, a window pops up and then you should
Good
click on
now.
share sound.
I got it.
Okay.
And I'm
How's
happy
that?
to sort of dive in just for a few minutes and talk about race and why it matters in myeloma care and survival, why we've created the Empower program. And I'm going to talk more about the Empower program after our break. You know, the IMF for 32 years is committed to every single patient and their care partner and their family and their community. For 30 years, we've been doing that all over the world. But as my daughter likes to say, every house on our street matters, Dad, but when one's on fire, we need to pay more attention to it. And so there is a house on fire here. And it is within the African American community, as I'm going to show you, Black patients have a greater risk of myeloma and inferior survival with myeloma. And so I want to just highlight to you a few sort of key facts around that. I got to list them in 10 simple facts. This is not a late show where we're doing a top 10 list, but I'm going to give you Dr. Joe's top 10, I think, facts that we find very important in myeloma. The first is myeloma is the most common blood cancer in African Americans. We've just finished Blood Cancer Awareness Month for the month of September, and the incidence is growing. So right now, African Americans may constitute about 14% of the country, but about 20%, as I'll show you in a moment, of all myeloma patients, and that incidence is actually growing. And we expect within the 10 years to that be up to literally one in 4 patients. Myeloma is twice as common in patients of African American descent. I'm of African American descent, and so I know this applies to me, but it applies to so many others. We're still trying to understand the nature of this, but we know that the sheer incidence of this disease is twice as high when we compare to white Americans. So this is why it's particularly important within the African American and Black community. Not only so, African Americans are typically diagnosed at a younger age. So the average age overall is somewhere around 70. 69 to 70, but it's much younger in the Hispanic and Latinx population at about 65 and about 66 within the African American population. And so this is another differentiating feature of the disease. As I mentioned, African Americans comprise about 20% of all patients with myeloma. So that means 1 in 5 patients in this country are Black. Or of African American descent. And we know those two phrases aren't exactly synonymous, but there is a lot of overlap, of course. And so it's really important for us to recognize the significance of this disease. We're going to be talking today, in particular, Dr. Smati is going to make mention of how we've had such huge advances in survival in myeloma, which is wonderful. I mean, I can argue that we've had a greater improvement in survival in myeloma than almost any cancer that we treat. But unfortunately, the degree of benefit that we've seen in that improvement is not seen to the same degree within African Americans. And that's just not acceptable. That's one of the reasons why we're having this program. That's one of the reasons why we're so committed to this, is that inequity is just not acceptable to us. One of the reasons for that inequity is the issue of delayed diagnosis. And so we are very committed, as we're going to be discussing today, around the notion of capturing a diagnosis quickly. If we look at all patients with myeloma, on average, independent of race or background, people see their primary care doctor 3 times with signs and symptoms related to myeloma, with what I'm going to be describing later, the fatigue, the back pain, the issues sometimes in their blood work. But the delay is even longer in African Americans for a whole host of reasons. Sometimes diabetes really confounds. You're going to see that a lot of the signs and symptoms of myeloma are similar to diabetes. And sometimes, our Black patients tell us, oh, yes, I was told for 6 months that all the things I was experiencing was just because I was diabetic. That's why I had the anemia. That's why there was a bit of protein in my urine, or that's why I felt this fatigue, when in fact it really was myeloma growing. Having access, we're going to be talking a lot about access to both the diagnosis features of myeloma and the actual treatment, and sometimes even awareness in the primary care providers. Someone doesn't think, oh, well, this patient's too young to have myeloma. I don't need to do the testing to find if they have myeloma, when in fact they do. And often access to specialists in the field, as we're going to be describing, is reduced within this community. Well, on that subject of access, sometimes I talk about the 4 T's. I talk about 3 of them on this slide. The access to treatments is a massive problem. And the access to treatments is particularly concerning in the treatments that we know have improved survival in myeloma, which include triplets, which is we're going to be talking about 3 drug combinations, transplants or bone marrow transplants or stem cell transplants, as we call them. And then this newest of treatments that we're going to hear briefly from Dr. Usmani about, what are called CAR T cell therapies. And we've shown, sadly, that African Americans are less likely to access these 3 T's, and indeed the 4th T, which is clinical trials. And sometimes clinical trials seem to be very scary to individuals. There's obviously a tremendous history here. We have a lot to do to repair that history that has created a systemic problem within our nation and within our healthcare system. But we know the clinical trials can have a tremendous positive impact on patients. And sadly, we know that participation in that trial is significantly less. Number 9 is that there are biological differences, and I don't want to get into too much detail here, but we know that bottom line that the so-called high-risk features of myeloma, because we think of myeloma, as I get explained to you, sometimes we think of it as standard and high-risk, meaning there are features that make myeloma more aggressive. It's actually less likely that African Americans have the high risk. They're more likely to have the standard risk. So you would think that outcomes, meaning survival, should be better in Black patients, when indeed, sadly, we showed it was not. But I end on a positive note, because we do have studies now that clearly show, and this was from a VA study where, at least theoretically, people are given the same access to care, that when given that same access, Black patients actually do better. And that's the goal here. That's the recognition that the current inequity is not acceptable. It's not acceptable that there's a late diagnosis. It's not acceptable that there isn't access to care, and it's not acceptable that survival is reduced. But we know survival can be better if we do something about it. And frankly, that's why we're all here today. So what can we do about this? Well, this is what part of our discussion is going to be today. And I don't want to go into a lot of detail here, apart from saying that This takes everybody. This takes the so-called lay community, what I call awareness, education, advocacy, and empowerment, which is a big part of course, the Empower project, that we are trying to empower people to change the course of myeloma. But it also is on us as the medical community to educate people better, to develop cultural sensitivity and competence, and to gain access to these therapies. And then lastly, within the regulatory and corporate communities, that they have a responsibility as well to set the right policy, to set expectations, and to be committed. And only with all stakeholders can we do this. And this is why we're doing this. We really believe, as the IMF, we have an opportunity that is unique because of the position we have in the community. And that's why we've created Empower, which stands for Myeloma Power, saying that we want to change the course of myeloma, because the current course of myeloma is not acceptable. It's not acceptable that this inequity exists. And in doing so, we're increasing awareness, we're engaging the community, as we're trying to do even today, shortening that time of diagnosis and educating our providers about how we can develop better care. So that's the heart of it today. That's the executive summary of why we're here and what we're seeking to do.
Bear with me 1 second.
We can see the slides, but it's not in presenting mode. You need to click on where it says from current slide. Yeah, there.
There we go. Thank you.
Thanks.
All right. So I know that was it was a few minutes long, but I thought it was very important to take a listen, because Empower made some very valid points on what's going on with this disease. First of all, we know that, obesity is one of the well-established risk factors for multiple myeloma. 13.6% is of Black adults compared to white adults are, facing obesity here in America. Of course, America is probably one of the most obese countries in the world. But in an effort to curtail what is going on with obesity, we need to understand the risk factors, and they are obesity, physical activity, and then having access to resources. So a huge part of the doctor's presentation, he was like, Black patients can do better and will do better, more so than any of the other groups, with access. So how do we get access? How do we present access, bring access within our communities? We have to learn to advocate for ourselves. We stand back, as I've said before, and we wait. I have a client right now who's a multiple myeloma patient. She's a white woman though, but she's in her 50s, but she's been able to reach out and access resources within her community and undergo stem cell treatment, and has come such a long way within the last 5 years, where she is now truly regularly working out with me. And she can even lift weights. She can do short runs and sprints and everything. It's a process, but she got the people behind her to help her move forward. The benefits, besides, of course, the learning about what those risk factors are, or what do we need to do for intervention, nutrition, exercise, mindfulness. Where can we access these resources? You're sitting in a community right now that has a plethora of information to this group that helps, supports, and sponsor other events where you can bring that information to your family, your friends, your constituents, so that we can get the word out. According to the World Health Organization, World Cancer Research Fund, I should say, and the American Institute for Cancer Research, among the 13 most common cancers, approximately 1 in 3 were preventable if a healthy lifestyle was incorporated, including not smoking, regular physical activity, balanced dietary intake, and maintenance of healthy weight. And a lot of folks are at a point, I don't know about you guys, as I get older, stuff I used to eat, I'm pushing 60 right now. So the stuff I was eating in my 20s and 30s, not only are they absolutely disgusting to me, I guess just because of change of palate, but your body just can't process that stuff anymore. And the longer you continue to try to process it, the more it's inhibiting what your body, what your immune system can do and respond to help keep you in a healthy lifestyle. Exercise is a structured component of physical activity. It reduces inflammation. It improves the immune system, as I said, and it can play a pivotal role in preventing obesity through increased muscle mass and reduction in tissue. You want to understand what your mental and physical health is. You know, do you have high psychosocial stressors? Is there mental health issues that have been often unaddressed? Um, are there integrated and culturally competent care um, resources that you can access? If you cannot, or you are embarrassed to do so, you need to reach out to a confidant or a group like HealthTree that can help you figure out what you need to do or whom you are trying to assist, what they need to do to keep their health in order. What we want to do is that we need to understand one of the biggest things, especially here in Chicago. I know you guys are coming from different uh, spots in the country. I think I saw Milwaukee. I think I saw South Carolina, Raleigh. So there are different stressors that all of us are facing. The biggest one here in Chicago, and if you're familiar, are the south and west sides of Chicago. I grew up on the south side of Chicago myself, and there are virtually no um, grocery stores that include healthy options for eating. No fruits, no vegetables, healthy meats. Everything is quick, very expensive. Food is expensive anyway, but there's no access. You have to go into the upper middle class neighborhoods most of the time to find something that is helpful, healthy, and nutritious to you. You know, um, with the current scenario that's going on with our government, the minorities, including Blacks, are going to be facing even further issues accessing this food and support because of the stalemate with the government shutdown. And I believe SNAP is supposed to shut down on November 1st. And SNAP is the food resource program that delivers you can use it for healthy food for your family and children. I believe WIC is still available to pregnant women, but the SNAP benefit for families, I believe, is going to go away at the end on November 1st. So we need to understand what is available. That means accessing your church resources, your food pantries. A lot of corporations, some of these big corporations, if you look into it, will have some access for helping people who need food. you have to be able to, and not as tough as it may be, you have to understand that there are people out there who want to help, but you have to learn to advocate for yourself. Especially as I'm looking at some of these survivor stories that I was researching, some of these people, you know, were misdiagnosed with uh, multiple myeloma. They thought it was one thing and it turned out to be another. Some of the symptoms that patients face happen to be other conditions. They just don't go into it a little further because they don't put in the factor that you happen to be a Black man or a Black woman. There are definitely clinical trials out there that can be used as alternatives to treatment and potentially be life-saving. And then you need to understand too what the community wellness support has to offer you as well as you try to manage this. There are some policy recommendations that I had been looking into as well. And this takes a little bit of research and a little bit of reading, but you need to understand what national campaigns are out there, the screening for expanded coverage for those who are facing the disease, and then inclusive research practices. Black Americans tend not to have access to some of this information, to most of this information, because again, they're not advocating for themselves. Whatever HealthTree is providing for you, as well as the Black Multiple Myeloma Society, are integral to ensuring that you have a successful recovery and that you can move forward being healthy. This is basically the end of my slides, but what I do want to bring up too is the importance of community engagement. Community engagement is one of the lifebloods that can help make or break what is going on in the Black community. Establishing community-based patient navigation teams is essential to improving patient risk reduction outcomes, and programs like Empower and of course Black Multiple Myeloma Society are just a couple of the organizations that can help you get where you need to be as far as your health is concerned. Gotta stop sharing. I think I stopped. Did I stop sharing? I don't know. Hold
No,
on.
it's still up.
Can you still see it?
Yeah, we can still see it. It should be down at the bottom closer, or maybe it's it depends on your computer. It's a little red button, stop share.
Now, how fitting that this slide is up right now, because now we're about to turn to talk to the man who's.
And then while we're waiting to get
There it is.
there she goes. So if you do have questions, you can go ahead and drop them in the chat or raise your hand. If you don't know how to raise your hand, go down to the bottom. You should see the raise hand feature.
Right.
If you don't see it, just wave at me on camera. We'll make sure that we kind of get your question addressed there.
And while you're coming out with that, some of my final comments, I would like to say that Blacks are at an increased risk of developing multiple myeloma due to possible factors, along with higher rates of obesity, a modifiable risk factor that can be addressed through various lifestyle interventions, including diet and exercise. Dietary intervention strategies focusing on weight reduction, especially those in individuals that are overweight or obese, may be one strategy in preventing the development of multiple myeloma. Additionally, exercise intervention that focuses on reduction and muscle mass development may serve as a potential mechanism in the risk of multiple myeloma. The combination of dietary and exercise intervention may provide a more holistic approach in modifiable lifestyle management and based on underlying racial, ethnic inequities in the Black population, including socioeconomic status and access to resources and support for healthy diet and physical activity regimens. There is a need for energy balance intervention that are culturally tailored to reducing risk of multiple myeloma development. Culturally tailored programs have demonstrated success in fostering healthy lifestyle in the Black population, though there is a lack of research specifically focused on multiple myeloma risk. The hereditary, dietary, and physical activity factors contributing to health disparities in Black and or African descent versus non-Hispanic white Americans are moderately established for risk of developing multiple myeloma. So consider the considerations to implement energy balance intervention may support effective care, preventative strategies for populations at elevated risk of multiple myeloma with a focus on efficient dissemination via multi-site centers. So again, we need to understand what our, excuse me, that we need to have our community resources. We need to make sure we have physical activity integrated in there, and then understanding that some of these issues we might be having physical and mentally might be one thing you're thinking about, but it can in fact be a potential diagnosis.
Thank you. Thank you for that, Vania.
Mm-hmm.
Very good points that you brought up. And a lot of times we don't think about how disparities affect our diet.
Mm-hmm.
We're seeing now, just based on what you shared with the climate of today's society and how things are going, with the food deserts and things of that nature.
Mm-hmm.
I'm glad that you brought that, to the forefront there. Very important information that you've shared with us today. And I want to, Daryl has put a very powerful question in the chat box.
Okay.
Since we are the leading demographic for multiple myeloma, why aren't there more targeted studies or specific clinical trials for Black people? The IMF often touts the Iceland-based iStop-MM study, but not many Black people live in Iceland. Now, Vania, I'm gonna let you comment on that. I have my, my comment, but if you're not familiar with that study that he's referencing, it is a study. Iceland has a very small population, so they're studying the people in Iceland to see for MGUS and how they go on to develop multiple myeloma. And as he said, it's not very many African Americans in Iceland. But just to give you a little background on that study there. But what are your thoughts on that?
Of why they would, first of all, do a study like that in Iceland when the
Well,
demographic.
no, just why don't we have more studies with African Americans?
Again, I think it's the advocacy. We don't advocate for ourselves, unfortunately. There are so many potential resource buckets that we can put our hands on, but we don't raise our hands until, and it's sad to say that, until it's almost too late. There are several groups out there, and I can always provide a list to you guys when I was doing my research for this, that, are trying to get these studies out, but they have to have people that want to participate and want to be involved with it. If we don't step up, we got to meet the researchers halfway. We really, really do. And I just don't think it's there yet where it should be.
Yeah, very good point. And one thing I'll say in regards to that, it starts with us. We have to be active participants. We have to be willing to participate in clinical research. For the scientists to say, hey, let's take a look at this. and clinical trial enrollment is part of the issue. And I understand why. I think we all understand why, the past things that has happened in history, those atrocities, those things are very, very real. And what I think we have to understand is now there are things in place to make sure that those things don't happen again when it comes to clinical research. I think it's just knowing that you can be a part of clinical trials and just that willingness, being able to speak up and say, hey, if a clinical trial is offered to you, saying yes, I want to do that. If your doctor is not talking about that, then you starting that conversation
Proactive.
and saying, am I eligible? Is this something that we would consider there? So yeah, I think it starts with us and just being able to advocate and expressing our interests, when the opportunity arises, saying yes to that. There. So I think that's one thing that's going to be helpful. And you can start with HealthTree. HealthTree has studies that you can participate in, many of which it's questionnaires, takes you maybe 5 or 10 minutes to kind of go through, answer the questions. That's where it starts, with small pieces like that. And then you can, you get comfortable with that, and then you kind of branch out to other things. But maybe Danielle, you can drop in the chat there some ways that they could get connected through Cure Hub and start participating in some of those studies, because they are available. They are available to you. Yeah. And also I wanted to, yes, the clinical trial finder as well. Thank you, Danielle. HealthTree offers a clinical trial finder. If you are interested in participating in clinical research, you can utilize that clinical trial finder to find trials that match the type of myeloma that you have, trials that match close to where you live, and things of that nature. So all of these are free resources that you can take advantage of. Yeah, and I want to mention the disparities course that we have. HealthTree University has a disparities course. It goes into details about the different disparities that we face within and other blood cancers as well. So I hope Danielle can drop that link in the chat. When you get a chance, just go through and listen to some of those videos where the myeloma specialists, the Black myeloma specialists, talk about the disparities in care. Yes. Great that our organizations exist. Yes. Thank you, Christina. Yes.
And I was going to comment on Christina's comment as well. And I totally get, you saying you can't advocate for what you don't know about. And that's when we have to learn how to be proactive for ourselves and ask some questions, whether it starts with our doctors, with our counselors. If they don't have the answers, ask them, who can we go to then who can you refer me to ask the questions? This is multiple myeloma, but I'm a vaginal cancer survivor. So there are not many Black women who, one, get diagnosed, let alone survive from it. And to get diagnosed with something like that and then have to go out and do the research on it so that I can't be sitting here 100% healthy again and talking about it, you have to put that foot forward. So with HealthTree, they've got so much stuff that a lot of us don't realize is already there to get that initial information, and then you dig a little deeper.
Yeah, and I think it goes back to having those conversations. Like in our community, we don't like to talk about it. What happens in this house stays in this house. We don't talk about health. We don't know what's going on with our family's health. I think that when we start those conversations and we talk about, or grandmother had a blood cancer, or, uncle had this, we start to know about our health history. And then that gives us the opportunity to be able to say, hey, I know this I could benefit from this. My children, my grandchildren could benefit from me participating
Yes.
in this. But I think we have to have those conversations. And sometimes you may have to be that person to start those conversations. I know for me and my family, I'm that person to kind of start those conversations because if not, it would never be talked about. So we have to be brave, we have to be bold, and we have to have those conversations when no one else is bringing that up. That is one thing you mentioned earlier in the presentation about that guru and the That's My Word campaign. It
Mm-hmm.
talked about that, start talking about your health with your family, your health history with your family. So I think that's another thing that's going to be helpful. Um,
Yeah,
when it
because as you get, if something happens, you're able to give that information to your medical team so that they have somewhere to start as well with what could potentially be going on with your body if you have this history that you know you didn't know about. I mean, and as you talk about, my family is old school, so to speak, and we are just finding out, on my dad's side, the prevalence of cancer. Everybody's always kept that under the sheet, so to speak. And it's been huge because, of course, I'm a cancer survivor. My brother, it's like it skipped a generation with my dad, and it came to me and my brother. He's prostate cancer survivor. I'm vaginal cancer survivor. But if we didn't understand where this was coming from, because he and I were both healthy people otherwise. Um, but you have those risk factors that can be, the difference between what's potentially curable or not, if you don't have that information.
Yeah, we got to start those conversations there.
Mhm. As
Um,
difficult as they may be.
yes, yeah. Um, we have another comment. I wonder
Mhm.
if the reluctance to participate in clinical trials is because one is looking for a solution to benefit now and not for the future.
That's true. And that's a valid statement, truly, because you're trying to figure out, you've tried other stuff, or you don't want to try what's out there, and potentially this clinical trial is something that might be um, more in line with what you feel for treatment or whatever. I definitely did not want radiation or chemo. I went more holistic with my treatment. And the same thing might be with the clinical trial. You just don't know. There's that unknown, the fear of the unknown. So you have to, some folks, you have to wrestle with it with yourself, knowing that there's a potential that you may not get any answers for what's going on in that trial. And then yes, it's whatever does come of it, it will help future people who are suffering from it. Do you want to do that and give back? That is something you're wrestling with yourself.
I agree. I agree. Um, I also think it's when it comes to, when you're in a thicket, when you've experienced a relapse and you
Mhm.
are, thinking about a clinical trial, obviously you want something that is, and if you've had more than one relapse,
Mhm.
obviously you want something that's going to help you right now, and you're not thinking necessarily ahead to how beneficial this could be for the next generation of people.
Mhm.
And I
Mhm.
think that's where we have to look at the whole picture when it comes to clinical research, and not necessarily the here and now. Well, it's not going to benefit me. Why should I put my body through this? You know,
Right.
and there's nothing wrong with thinking like that. You can definitely think like that, but just think about our community as a whole.
Mhm.
We want to find and be a part of that cure for multiple myeloma. And if it means sharing your data today that will bring a cure tomorrow, then let's work as a community to do that.
Agreed.
Let's see. If we participate in trials, will the data be specific to the African American community as a means of determining why we are affected disproportionately? Um, I don't necessarily think it's going to give us that. Let me first, I'm not a doctor. I can't give you that. But I don't know. James asked that question there. One thing that I know that they are looking specifically at, James, I'm not sure if you're familiar with the PROMISE study. Maybe Danielle can drop some information in chat on that. That is an observational study. And what that means is you're not taking any kind of meds or anything. You're just being observed. And that is for individuals that have a loved one, a first or second degree relative that have been diagnosed with multiple myeloma. They're looking for the precursor condition. Um, and with that, they are specifically looking at the African American population to see, okay, what is going on? And for those of you who are not familiar with MGUS, monoclonal gammopathy of undetermined significance, it's the precursor condition to multiple myeloma. Everybody that has multiple myeloma at some point had MGUS. So what the PROMISE study does, it looks at your risk for developing MGUS to kind of determine, the likelihood of going on to develop multiple myeloma. So that is one means, not by far the only means, but it's a good way to start participating. Again, it's no meds, it's observational. So they're just watching what happens to see with that MGUS state there. So I hope that answered that question a little bit there as best I could. So you had another question there. And I'm just going to the questions in the chat because I didn't see anybody with their hand raised. If you do have a question and you want to ask it out loud, unmute yourself. You can raise your hand just so I can see you there. So the participant says diagnosed in November 2024 and currently about 90 days post stem cell transplant. There's a lot of information attached to this disease, diagnosis, and treatment, and at times overwhelming. Yes, it can be. However, it's not optional for me to sit back and not ask questions. My care team knows who I am and know I will have questions at every appointment. I don't have all the answers, but I'm determined to find out the whys. And I say kudos to this for being a self-advocate. You are advocating for yourself, and that's what it takes to survive multiple myeloma. Where's my little clap hand button here? Give you some, I want to give you a clap there. You're doing the right thing. And I hope you are recovering well after the stem cell transplant. And keep asking questions. That's where you're going to make a difference, is when you ask questions, when you go into your doctor with those questions already written down, whether it's on a notepad or piece of paper or in your notes in your phone. Speak up and ask those questions. So kudos to you for that. All righty. Any other questions that we have? It says, I would love to participate in a study that monitored my health prior to diagnosis. My dad passed in 2009 with multiple. I'm sorry to hear that. I never even imagined I might get it. It's diagnosed pretty early stage 2021. I wonder if my brother could participate. Yes, your brother could definitely participate. If you click on that link, and we'll put it in the follow-up information as well. The PROMISE study is open to anyone age 18 to, don't quote me on the cutoff on that. But if they're 18 years of age and they have a first degree relative, which, a father and son, that is a first degree relative, they are eligible to participate in something like that. And I will say, for those of you who may be wondering, well, what is the what happens with the PROMISE study? They will send you a kit in the mail. They'll mail it to your home. You can take it to like a Quest Diagnosis or a LabCorp, and they will draw 2 vials of blood, and then they will send it to the study facility. It doesn't cost you anything. It doesn't cost you anything to receive the kit. It doesn't cost you anything to send the kit back. And what happens if they find you to have MGUS, they follow up with you, and they continue to do blood work periodically. If you don't have MGUS, they follow up with you in a few years, but it's not regular follow-up there. If you don't have a Quest or LabCorp in your area, you can take it with you. Like if you know you have an upcoming appointment to the doctor, take it with you. When they do your blood work as normal, they will draw a couple of extra vials of blood, and they will send it off to the institution where the study is being conducted there. Definitely click on that link in the box there. That my son did the promise study. Okay. Yes. I've invited family to do that. Thank you, Lovey, for doing that. That's what it's about. That's what it's about, making the difference. Well, it's coming up to the top of the hour. I do want to thank you all for joining us here. Vania, as always, thank you. Do you have any closing words for us today, Vania?
Keep moving, eat healthy, eat healthier. Everybody here is eat healthy, but try to eat a little healthier than you did the day before. It's you didn't get that way overnight. It's the transition is not going to happen overnight. So if you do it one step at a time, you will you'll get to that goal where you have a healthy balance, that energy balance, which is good nutrition, and physical activity, and then understanding what's going on with you.
Yes, absolutely. Thank you. Thank you for joining us today. Now, as you leave the session today, we definitely appreciate you taking 2 to 3 minutes to fill out that survey that I mentioned about your experience here today. And then I invite you to join us next month. Now, next month, we are going to be meeting on the 3rd Thursday in the month instead of the 4th Thursday because of the Thanksgiving holiday. Same time, just a different Thursday. And we're going to be joined by senior nurse clinical educator Kim Burney from Johnson & Johnson. And if you haven't met Kim, Kim is amazing and she brings the energy, so you want to be a part of this. She's going to lead an engaging discussion on shared decision making as part of being the essential part of navigating your myeloma care, and just ensuring that your voice is heard in every step of treatment. And then in just a few days, we're going to be in Greenville, South Carolina for our next Meet, Meet, and Learn event. If you're in that area, I would love to connect with you there. So please join us. If you are not familiar with the Meet, Mingle, and Learn events, these are informal gatherings. They're created for members of the Black community affected by blood cancer, recognizing that, multiple myeloma has a higher impact and with those disparities. So, the events offer a supportive space for patients and caregivers to connect, share their experience, and to learn from one another. We have presenters and community members that lead conversations on topics like financial assistance, emotional wellness, and they're really to help participants feel informed, empowered, and understood. So we're always looking for the next city to visit on that. So if you'd like for a Meet, Mingle, and Learn event to come to your city, put that in the survey when you're filling it out. We definitely appreciate that. One other event we wanted to mention to you, on Monday at 6 o'clock, you can join us for another community webinar, Caregiver Connection and Conversation. The link to sign up for any of these events that I just mentioned, as for as many more. It can be found on the bottom of that slide that you see. And it's also going to be sent to you in a that follow-up email. As always, I want to thank our sponsors, without whom this event would not be possible: GSK, Pfizer, Kite, Johnson & Johnson, and Amgen. And before we wrap up, I just want to say thank you again for being a part of the multiple myeloma community, the blood cancer community. Your support means so much, and I am definitely grateful to have each and every one of you here. You can see my email there on the slide, so don't hesitate to reach out if you have any other questions about HealthTree or any of our programs. I'm always happy to help you. I truly appreciate each of you, and I hope that you all enjoy the rest of your day, and hopefully I'll see you on another webinar soon. Have a good one.
Thank you.
You're welcome.